Hi, and welcome to Verisk's Emerging Issues. My name is Kevin Sullivan. I'm an analyst and writer with the Emerging Issues team. Today, I'm going to be reading our article from October 12th titled Good Data Stewardship May Be a Key to Bridging the AI Trust Gap in Healthcare. Let's begin. Artificial intelligence tools and medical devices are increasingly being developed and deployed across the U.S. healthcare industry, including in the areas of imaging, personalized medicine, and data management. Although use of these innovative tools continues to grow, doubts about their appropriate place in healthcare nevertheless persist among the public. A sweeping survey of public sentiment released by the Pew Research Center in February found that 60% of Americans surveyed are uncomfortable with their medical providers relying on artificial intelligence, revealing a telling trust gap between the possible and the preferable regarding such advances in technology in a field commonly associated with personal touch and attention. The algorithm will see you now and for the foreseeable future. The healthcare space has seen a variety of developments and advancements in artificial intelligence technology in recent years, offering hope that such innovations might help mitigate staff shortages and physician burnout in the industry, while potentially improving patient wait times and levels of personalized care. In a recent analysis published in the Curious Journal of Medical Science, researchers pointed to cases in which computational models were able to detect cancer in mammograms with, quote, comparable accuracy to trained radiologists. Similar results were cited in a 2017 study in which researchers found a trained deep learning system to be, quote, on par with the expert's assessment of retinal images in the diagnosis of diabetic retinopathy and glaucoma. In another study published this past September, researchers discovered that an AI system designed to interpret fundus fluorescein angiography in retinal images was able to complete the, quote, entire process from image phase identification to ischemic area segmentation in approximately 8 seconds, suggesting, quote unquote, transformative potential for ophthalmological diagnostics in the years ahead. Further, in a report published this past August in the medical journal Gastroenterology, it was reported that researchers from the Mayo Clinic Comprehensive Cancer Center were able to build an AI model capable of deciphering visually imperceptible cancer in pancreases a median of 438 days earlier than typical clinical diagnosis from CT images. The U.S. Food and Drug Administration has authorized more than 500 AI and machine learning enabled medical devices since 1995, the majority of which relate to medical imaging. More than half of those algorithms were authorized in just the past 4 years alone, suggesting that the technology may become more commonplace across the healthcare industry. Just a little of that human touch. The days of doctors making house calls may well be behind us. That doesn't mean that patients are entirely prepared to forego human interaction when it comes to their health and well being. Indeed, in numerous test scenarios, consumers expressed a preference for human medical providers, even in cases where the automated provider might demonstrate superior performance over a human. In the aforementioned Pew study, pollsters found that while 4 in 10 Americans surveyed believe AI would reduce mistakes made by healthcare providers, a majority expressed that the relationship with their medical provider would likely suffer. Researchers pin much of the blame for the public misperception on medical AI on sensationalist marketing and media discussions around the topic. Still, there apparently exist very tangible and demonstratable concerns around the increased role of AI in medical care, namely in the areas of data security and bias. On the latter, evidence suggests that medical data collection often tends to be disproportionately representative of patients from whiter and more affluent locales, which could potentially affect accuracy and precision when used with other racial and ethnic groups. As the authors of the Curious report put it, algorithmic, discriminatory, and systemic biases can impinge on the principle of beneficence and erode public trust in AI systems, creating skepticism and further hindering the adoption of these technologies. Encouragingly, Most of the respondents who told Pew that racial and ethnic bias was a problem in the healthcare industry said that AI technology would likely improve the disparity. On the matter of medical data privacy, there is an already troubling record on artificial intelligence, or the lack thereof. In 2017, British government officials accused a London hospital of failing to comply with the Data Protection Act when it handed over personal data on more than 1.5 million patients to a prominent tech company. In 2019, The Guardian reported that that same tech company was gathering personal data on tens of millions of Americans to help develop AI-based medical services. Increased partnerships between public and private entities on data management toward the development of more advanced AI devices may, according to a September 2023 study published in MPJ Digital Medicine, put the onus of analyzing and understanding the implications for patients back on humans. Building a scalable bedside manner. On the question of processing, safeguarding, and applying an abundance of medical data, the answer may come down to human acumen. In the NPJ Digital Medicine study, two analysts from the American College of Cardiology call for more progressive thinking on the most advantageous relationship between humans and machines in the realm of medicine. While many advancements in artificial technology rely on machine learning, a process by which trained machines and models to replicate human intelligence and behavior, the authors rather call for a shift toward collaborative intelligence, a model in which humans not only train algorithms, but also quote unquote work in concert with them. AI holds the promise to transform the ability of humans to interpret substantial amounts of data which the brain has not previously been able to process, end quote. Data for which human operators would ultimately be held responsible and accountable, the study authors argue. Far from replacing human agency, collaborative intelligence would require humans to understand and analyze data at a scale hitherto unknown. A quote unquote standardized and transparent infrastructure linking the traditionally disparate pools of medical data across the country will therefore be crucial to effectively apply such thinking, according to the study. And with ever abundant health data being volunteered by patients through things such as wearable medical devices, a product market anticipated to grow beyond $245 billion in value by 2032, the need for human acumen may only become greater. For more information on this or any topic we're tracking, please visit us at www.core.verisk.com/EI. While you're there, be sure to sign up for our weekly newsletter. Thank you very much for listening.